before I came on, I was trying to think about specific cases. And I had a child who came to see me. She was a tennis player, very, very good tennis player, was going places with her tennis. And my opening line to a lot of these children, having decided what they're called, is tell me about what you're missing most. I get that you're injured right now, but tell me what you're missing most. And quite often the parent will go, well, she's, we need to get her back to tennis. And I'll be there going, yeah, but what is it that you're missing most? And I really try and get to the kids' why. What is it that makes you want to play sport? And what came out of this kid's mouth, so bear in mind, tennis, one-to-one sport, doing well. This kid's really high end. And so out of this little one's mouth came netball. I'm missing netball. And the dad goes, don't be ridiculous. You're a tennis player. And I went, let's just hear what she says. Give me a few minutes. Let's just explore this.
Well done. You have finally discovered the most important health podcast you will ever need as a medical professional. The conversations you are about to hear are guaranteed to change your clinical practice and hopefully transform you into a better conversationalist. They could even make you better crack at parties. Welcome to Teacup, where swearing is guaranteed. Angie Jackson, how are you doing?
I'm good, thank you. How are you?
I'm good.
Good to hear.
And thank you for coming on.
My pleasure.
And we suppose that it was interesting, considering it's a communication coaching podcast. How we met was always interesting. That it was actually an in-person conference, which I don't know what you think, but it's always good to go to in-person conferences because every time I have, I've made loads of really good connections. And it was kind of funny the way we met. And then I think I was slightly half cut when I was chatting to you, and I said something like, like some sort of ape man, I like your stuff, or something pretty something daft like that. I think it was. And she replied with, "Good, thank you." That was our introduction after a few bottles of beer and wine. So I think that's. But it's good though, isn't it? When you meet up and then you meet with a load of people. I thought that was quite a nice way, and hopefully this year as well. You know?
Yeah, no, I think actually it was one of my favorite conferences because I think they did a drinks reception afterwards. And through that, you got to just chat informally to an awful lot of people. And I think the Andy Thomas then put a group of us together. And I think that was a really good networking evening. And we all really hit it off, but lots of mutual conversations that have expanded and supported us all since, I think.
Yeah, and I think that's what I wanted to say when you came on, because as part of these are kind of conversations you would not have. Like sometimes with conferences, you kind of go there. It's quite a tight structure. It depends on who you sit beside, and then you might. I think I was talking to somebody else about this, and then you might go into the break. You might get caught with somebody for a bit, and that's fine. But then that conference seemed to allow us to have a little bit more freedom to move around a little bit, not feeling that you had to always go and listen to a talk. You could just actually hang out with people. So therefore I found it quite useful. I don't know. It was just it was a nice way. And then I suppose the important thing is making the effort to go to these things sometimes, because you can get away with doing a lot online. And I don't know about you, but online stuff is okay. But I far more, I prefer more teaching in face to face.
Yeah, and I think that for me has been really defined in the last few weeks is that during sort of for different months of the year, I try and schedule my in-person teaching to certain months pretty much to align with the school holidays when people are around to learn. And I'm not swanning off to some warmer climate during the winter. And I've just had 3 back-to-back in-person teaching sessions, and I was buzzing with energy after them. Absolutely loved that real in-person interaction, and trying to work out how we bring online webinars and things more interactive, to be honest, because I think people can misinterpret what you say sometimes. They don't feel confident to ask questions, whereas when you're reading that body language and the nonverbal, you know when to move things on, you know when people haven't quite got it. And for me, there's nothing quite as good as being in the same room as somebody, much in the same way as I think online and in-person clinical appointments. We all got through them when we had to, but I'd never choose it.
Yeah, exactly. Yes, it is. Sometimes, hearing a webinar, you just can't be there. Brilliant. At least we have that option. It's a great option to have, and it can be really useful. But there's sometimes that, even I was on a course there. I ran one last week in London, and none of them knew each other. But by the end, you could see them all again making these little connections throughout. Like at the first lunch, everyone was talking like they knew each other. So you kind of remind yourself of that, because I think it wouldn't be a podcast about communication if we didn't mention that. But before we go on, we could go. I got to watch myself. What I'd like to do is just a little. I've done it with everybody else, and I think it's a bit of fun. There's a kind of a this or that, and you can just answer which one you think comes into your head straight away. All right.
Okay.
So, coach or therapist?
Coach.
Communication or exercise?
Communication.
Osgood Schlatters or Severs?
Osgoods. Neither.
Swearing. You can't do that's what Andy Osgood said. You can't do neither. It's just daft anyway. It doesn't make any sense.
No,
I was trying to think of really daft paediatric things to say. Swearing or not swearing?
Not swearing.
Dancing or chatting?
Dancing.
Teaching or treating?
Teaching.
Warm fires or warm sunshine?
Ooh. Warm sunshine.
Physio in sport or playing sport?
Playing sport.
Rugby or football?
Football.
Good woman. Wine or G&T?
G&T every time. And last night.
And right now. That's great. That's great. Look, they're daft questions, but it's just...
I like those.
I said to other guests as well, yeah, they just get you. People now know a lot more about you than what degree you did. And where you come. We all know you're well qualified. So I kick off really is because obviously your background a lot is in kids and young adults and in sport. What do you think are the challenges facing therapists with regards to communication with kids specifically? And you can include parents in that as well. Where do you see the challenges mostly? And we kind of go from there.
Yeah, I think it's a really interesting one. I can reflect back on my own journey, and I became a physio, typical story, got injured. And I was, I'm actually presenting on the challenges of rehab in ACL adolescents shortly at a conference. And I was writing the slides and really began to A, look at the literature, but B, look at my own lived experiences and those of the kids around me. And I think all too often, certainly when I was injured, nobody really ever asked me whether I wanted surgery, what I wanted to get back to. And there was this certain assumption, because I was quite good at the sport I did, that was very much wrapped in with my identity, but also my parents' identity. You know, they were the father of the tennis player, the mother of the tennis player, and everybody just assumed that is what I would want to get back to most. And I think we all too guilty back in the day when I qualified of the consultant told you what to do. And we as clinicians at that time, we did what we were told to do. They even prescribed some of the actual modalities we would use. And I think we've moved such a long way from that. But I still find that we don't necessarily, specifically with children, give them enough choice. We don't give them enough autonomy about what's important to them. And so I think trying to help children have a voice is probably my biggest thing from my own experiences, and also working with just thousands of kids since. Parents, I think, can think they understand what the child is thinking and think they understand the story. And I find that I've got various techniques I use, but trying to navigate those first conversations with a parent in the room and a young person, particularly those that are just going through puberty and adolescent, they're just they think they're adults, but in the eye of the law, they're not. And how do we help them to articulate what's important to them?
Yeah, there's loads of stuff in there. If you don't mind me just kind of maybe rooting around in some of that stuff, because
Of
that's really
course.
good. So, giving that child a voice, and I suppose that's the skill. And I was talking to another Ben Cormack on here about like how difficult the communication can be. It's very difficult. It's very difficult to measure. It's not tangible. It's like how do you know you're a good communicator without sounding like very arrogant or cocky about it? And only the person in the room who you're communicating will know if you're good enough or not. You know what I mean? Especially when it comes to kind of trying to meet, especially like meeting people anyway, adults. We have to kind of meet them in a very short space of time, get really important information from them, and then build trust really quickly. And that whatever about an adult relationship and the maturity that comes with that, but then to do that with a child and their parents in the room with them. That's you mentioned various techniques. I'm not expecting you to kind of go into techniques. Is there any little tips or clues, or like it mightn't work for every parent, but have you got that kind of, when you go in the room, is there something that you think, you know what, the most important thing here at the start will be this type of idea? Do you know what I mean? Is there anything
I
like
do.
that you
Yeah,
do, or
absolutely.
yeah,
I
yeah? If you
think,
share that, yeah, that'd be great.
yeah, I think one of the easiest things I would always start with is um, asking, let's say my name is Angela, but I have always gone by the name of Angie. When I'm called Angela, I assume I've been naughty. So one of the first things that I kind of do to speak to the child is say, I noticed that your name is Frederick. What do you like to be called? What do you want me to call you? And then let them know. And even that with children is really important, because I always had all this sort of introductory bit talked about as a treatment bank account. And I try and get in credit with the child really quickly with just getting that right name. And I think the important part then is to use that name when you're trying to direct the questioning. So what I'll quite often do is say, I'd like to ask you a little bit about when the injury occurred and how it occurred. I'm going to ask you those questions, Fred, or whatever he's asked to be called. But if you need any help from your mum, you're really welcome to get her to turn to her for help, because sometimes it's hard to remember those things. So I'm kind of defining who I expect to answer those questions. And then very quickly, I'll say, and I'm quite deliberate on it, Fred, could you tell me about? And then, actually, Mum, could you tell me about when he was little? What had, and then
Yeah,
back to Fred again. And I'll direct that conversation utilizing Mum or Fred. And so everybody's really clear. And the tricky part is that in an adult conversation, you and I might leave a little pause to give somebody time to think about it. But I think in children, we have to be very careful with that, because the parent butts in. And I'll often just say, that's quite a complicated question for me to ask. And maybe I didn't phrase it quite right. I'm always keen to tell children that if they didn't understand a question, that's my fault, not theirs. And I'll always make them realize that they shouldn't know the answer to this. I'll often highlight that they've not had an injury and they shouldn't have the vocabulary. And then really making sure that we stick to their vocabulary. If they've called it an ache, we have to call it an ache, whatever we might want to think it's called, but using and I flip it and mirror their vocabulary all the time.
oh, brilliant. Yeah, really, it's great stuff. I'm absolutely robbing all of that, and because it just gives you that's what I mean. It's that's great because it's just very clear from the beginning, and you're given that thing you said originally about the voice. It sets up the situation to when the options come down to what we're going to do about this. They still have that decision to make because you've addressed that
Yep.
from the very beginning, and that permission to the parent is great because it's probably answered another question is like, how do you stop that happening? Because it's sometimes that will work and probably other times it may not work as perfectly as that, and I'm sure you'll get that where someone will still interrupt and potentially you're having to navigate through a difficult communication when a parent maybe just doesn't pick up on that. But I think that it's kind of like nearly like contracting somebody straight away. Everyone knows where their position is in the room, and then that mirroring vocabulary is brilliant, because that I suppose flows into, and it's just kind of coming out of me now rather than kind of going anywhere else. I suppose that ties into then when you're giving them coaching cues and rehabilitation. Do you see kind of similarities there with language?
I think the interesting part with certainly working with children is that for the most part, I use what we call implicit learning. So my coaching cues would be very much, if you think about when you learnt to drive a car, or when you learnt to ski. Skiing's a really easy one that we use as an example with children, is that the ski instructor, usually not necessarily in the child's native tongue, doesn't need to really be able to speak the same language. They need to be able to give an analogy, or bring on something that the child already knows and feels confident about. And so a ski instructor often uses the pizza and chips to snowplow and go straight. And the child immediately can visualize that. And we call that kind of implicit learning without realizing, and using those external cues which are outside of the body. What's, I think, really important is we don't get the child too hung up on what's going on inside them. So I never talk about any anatomy whilst I'm working with kids. Very, very rare you'll ever hear me utilize any of the sort of terms of put your knee here or put your butt here. We're more likely to be giving them a example of how it will fit with the sport that they want to play, so they can visualize how that's going to help them get back to sport, but also not get them too embedded that they can do it as long as they're really, really thinking about it in the treatment room. But what's going to happen when little Fred gets back on the football field and now he's got to process lots of information? So I think there's a lot that I work on, particularly on my in-person courses. We spend a lot of time trying to get clinicians to really think about the language that they use. Does it inspire confidence? How could they build that expectancy in the young person that they're going to be able to do something that might not be now? And how do we believe in them that they can achieve this? And I think language is just massive in that. And I think there's a guy called Nick Winkelman, and he writes, he's a sports coach, and he writes about language. I think it's called the art of.
The science of coaching. The language of the
language of coaching.
I think. The language of coaching.
Yeah. And that was a lot of stuff pivotal for me. Both my kids did sports coaching degrees, sports science at university, and I remember reading a lot of the stuff that they were taught about how to teach children exercise and motivate them, and kind of going, I just wish I learned this as a physiotherapist. This is dynamite about how we can motivate children to want to do exercises, to get them to retain them. And they're not words that we know. Like, they're coming into the neurocognitive world of rehab now, but they're certainly massively missing from our undergraduate training. And I think we can do more damage with the wrong language in the treatment session, and really kind of debilitate movement and competency and ability to transfer it outside the clinical room.
Yeah, and look, what you just said there just is the reason I set up or wanted to do this podcast and start to speak to people about conversations in more detail. Because again, like from previous guests has mentioned, like, do we do lip service to communication skills? You know, like that kind of like, oh yeah, we do all that kind of stuff, but I assess a need like this, and this is what, you know, here are the biomechanics of so-and-so injury, and here's the so-and-so rehab that this evidence has shown us. Instead of actually, as you just said, it can sometimes, language could be far more detrimental to it than anything else that we do, or everything else, you know, in that assessment. You could poke around and make it really sore, but actually the words you're using can leave a long-lasting effect, and could even affect them sleeping that night, or even into their emotional management for the rest of that week, or how that would, you know, how's that sat with them with regards to going back to sport, kinesiophobia. It's just, it goes and goes and goes. So I think if anyone was listening to this and they're a therapist, like you mentioned in one of your quick fires that, you know, communication more important than, you know, sorry, you didn't say that. It was communication or exercise. And I put that in there because I've done some talks about the saying that communication is more important than exercise. And the reason for that is obviously exercise is important, but like you just said, if you don't have that understanding, that emotional intelligence, and the understanding of how that information is being received by the child, you could really, it's going to be very difficult to rehab them down the line. What would you say to therapists there, like, wanting to get into this field and how important it is around communication? Like, what's your thoughts on that?
Yeah, I think I think it doesn't matter how strong you are, and that's hard for me to say to somebody who teaches a strength and conditioning course. But it doesn't matter how strong you are if you then haven't got the confidence to implement and you haven't basically overcome some of the psychological things. And I think there's a couple of things that I think we really need to get stuck into, is particularly with children, maybe, is their beliefs and what beliefs are there, and trying to unpick that, because we know that the child will have FOMO. We know that the injured child is basically they're going to be worried about other children are improving whilst they're not able to play. Will they get their place back? Are they going to get better? Is it going to happen again? But critically, these kids, and I remember this so clearly, I went, and my two kids have played to a high level and been injured at times. And suddenly you absolutely remove them from everything they know. And so they lose their structure. So you could have a child who's running around like a lunatic, playing lots and lots of different sports, and you suddenly give them loads and loads of time because they're injured. Well, that kid does not have a clue how to do time management. They're incredibly good at putting their homework into bite-size, like lunch breaks, and doing it on the bus and working under pressure and being able to allocate time to all the things they need to do. But when they actually are faced with having lots of time, they are absolutely clueless. And this was quite a revelation to me about how actually poor I am at managing time when I have time. And so I think you need to take that time with kids, particularly to understand the impact of what we've just pulled the structure out of their world. What often happens with kids is they'll play in the morning and then the game finishes and everybody says, oh, great, shall we go into town now? Or shall we go to the cinema? That kid, if he's not there, suddenly loses his whole social network. They lose their kudos. They lose their, like, as I said before, identity, self-identity. They were the kid who was like the hub of the team. They were, the absolute hero of the school. They were in all the newsletters, and boom, overnight, ACL, osteochondral injury, something quite big. This kid's out for an entire season. But the reality is that when kids are growing, they may not get back to that same level. And we've got to understand what's going on in this little kid's head and understand those fears, because I think, as I say, it doesn't matter how strong you are. What we know is that if you do some of these outcome measures, even the strongest kid can have quite big fear, and as you called it, kinesiophobia. They can, have real anxieties about what's going to happen, not just about will the injury occur again, will they be good enough again, but what's the implication for their wider environment and competition and the performance and things like that. So I think that's pretty big. But I think also trying to understand what motivates them. Before I came on, I was trying to think about specific cases. And I had a child who came to see me. She was a tennis player, very, very good tennis player, was going places with her tennis. And my opening line to a lot of these children, having decided what they're called, is tell me about what you're missing most. I get that you're injured right now, but tell me what you're missing most. And quite often the parent will go, well, she's, we need to get her back to tennis. And I'll be there going, yeah, but what is it that you're missing most? And I really try and get to the kids' why. What is it that makes you want to play sport? And what came out of this kid's mouth, so bear in mind, tennis, one-to-one sport, doing well. This kid's really high end. And so out of this little one's mouth came netball. I'm missing netball. And the dad goes, don't be ridiculous. you're a tennis player. And I went, let's just hear what she says. Give me a few minutes. Let's just explore this. And the kid looked close to tears. And I said, I used to love netball. Not quite true, but let's make the kid feel like, we're on the same page. And I said, I absolutely used to love netball. I used to play with my friends. What is it that you love about netball? She said, well, it's great because it's a team sport. We all play together and then we all go to lunch together. And then then we plan what we're going to do at the weekend after we've played. And I said, do you not get that from tennis? She said, well, my tennis friends live all over the country. And this dad's like, I thought he was going to smack my lights out in truth. But at this point, we're having this conversation about how we're going to prepare her exercises to first of all get her back to netball. And meanwhile, back at the ranch, dad's in meltdown. And I said, but I think what's important, Dad, is many of the skills that she needs for netball are going to cross straight over into tennis. But maybe because it's a team sport and maybe because she only needs to cover a percentage of the court, then that's going to help her to build back to tennis. So this is a great stepping stone. So it was trying to kind of keep the parent on board. You never want to alienate the parent to the point of, I'm not taking you back there. They don't know what they're talking about, or getting the kid into trouble. Quite often that kid's going to look at me as if to go, if I answer that how I really want to answer it, I am going to be in so much poop later. And therefore, it's trying to enable the child to have that voice and share with you what's important to them and try and really understand why they do what they do. But actually enabling them to still stay within the family dyad that's going to be quite a complex picture for many of them. And so I see with a lot of the little soccer players or tennis players where there's big money at stake. These are life-changing sports for families who get a kid who does well, is that there's so many things that are into playing and how so much money and time being spent by the parent. And that child trying to articulate that maybe that's not their dream anymore, or maybe there's other things they want in their life. And I feel like I'm in such a privileged position to help them find that voice. I guess we're using that word again, but it is about setting up conversations where you get the right information to help drive your exercise prescription. I now know the language that this child, so when we play netball, we need to be able to decelerate and land under control. To do that, we need to do these exercises. We need to get that strong. I'll always then bring the netball into the session because the kid's more likely to understand the movement pattern than me talking about a single leg deadlift or a single leg squat. So part of that learning without realizing they're learning is me giving them cues that are related to their sport. But I think critically here, it's about helping them find what they want to do in their return to sport. Because quite a lot of them, 8 months out, 9 months out, they don't necessarily want to go back to what they were doing before.
Yeah, it's really good. And it's interesting you said about me and strength and conditioning, or like I would say, definitely, and anyone who's been on my teaching courses is actually I would be exactly the same. The most important thing on my course people come away with is exploring someone's want before anything else, and that you build rehab around that. So it's great to hear without any kind of prep of you. You can swear that you didn't that I didn't prep you for this to say it, because that's exactly the same as whether it's with children, and obviously there's those different dynamics which you've highlighted really well, but also in the fact that with adults are the same thing. So some like adults they'll come in and be like, I want to be out of pain. And then you're like, yeah, of course, everybody wants to be out of pain. It's nearly a given, I would say. This is my opinion on this. And I'd be like, but what you really miss, what is the thing that you want, that's going to excite you? The thing that you're not doing because of the pain. Just skip the pain bit. And then once you've highlighted that face, I had a woman today, for example, and she talked about she's got rheumatoid arthritis and her hands, and she's also got some neck stuff going on. But I was saying, oh, what are your hobbies? And she went, oh, jigsaws. I went, oh, brilliant. And she said, why? I said, well, you're picking up little tiny pieces and you're moving them around and you're working, for other reasons, like for, just working your brain and stuff. I said, it's perfect for your hands and fingers because you have to fit this in. And I couldn't have picked a better exercise for you in some ways. It's dexterity. It's trying to use them. You don't want to lose that. She was like, her face went, oh my God. she went, I'm going to go and buy some today. Like,
Oh,
she nearly went, it's like someone had just said, I did not expect that reaction. I thought she'd just go, oh, okay, fine. But she literally lit up, went, I'm going to go buy some today, kind of thing. And I was like, wow, it's just, sometimes it's these subtle things that you do not realize. They're just saying to somebody, go make a jigsaw. And she had some reason in her head was that maybe I'll need to stop doing this. And it was
I
such a
think it's
bizarre
bigger
way. She
than
was
that.
like, you know what I
Yeah.
mean? Do you know what I mean? Like for her, it was just that these things are. It's whether it's children and adults. There is that thing that you want, and it's interesting. The dynamic with a kid is that it's not just what they want; it's also possibly what else is going on, and to navigate that does require sound communication skills, and that's what I kind of want to ask you as well, because obviously everything you're saying is gold dust, really, and you say it with such clarity. Where is that? Where have you kind of learned that? How have you learned that? Tell me a bit of a story around how you've kind of identified that, when it was, what story, etc.
I guess that first sort of learning was being on the receiving end of not feeling like I had any choices. I was 16 when I got injured. I thought I was an adult, and therefore understanding that my journey wasn't perfect and lots of things just happened to me, that even probably going to physio school was decided for me. I couldn't go to Loughborough, so well, she might as well go to physio school because she knows about that. And lots of things just happened around me that made me realize that I probably didn't want a parent like that, and I certainly probably didn't want to be a clinician like that. And then we had a student physio teacher called Marilyn, and she came in and she was just so vibrant and just enthusiastic, more so than anybody I'd met since I started my physio journey. And she came in and she said, I'm going to tell you now, I probably don't know very much. And I'm sort of probably going to have to go and look an awful lot of things up, but I'll never lie to you. And if I don't know the answer to one of your questions, just, let me go and look it up and see if I can find an answer for you, and I'll come back to you. And I loved it. I just thought, I always thought I'd probably have to know everything as a physio, and what was going to happen if I didn't know. And this was probably so early on in my career, one of the most powerful messages I ever got. And I used it from day one. When I opened my business, it was very much about teaching our clinicians that I never wanted them to feel like they should know everything, and that we'd always help them find the right person for them. And I adapt that to so many situations. Is still to this day, I will see conditions I've never seen before. But I think if we're going to build trust, and kids, I think you're a parent, I'm a parent, is that we absolutely know that kids see through lies. And if you've ever lied to them, it's really hard to ever get that back. So there's times and places where I have to deliver really cruel messages to kids about things that are going to happen. You're not going to go and captain your country. You're not going on tour next week. You are going to miss the whole season, or you may never get back to that sport. And I think that's one of my challenges, because I'm a big softie and I don't want to see them cry. They equally don't want to see their parents cry. But I think that's just incredibly important, that we build that trust and we're always honest. And that started at physio school, when I was taught very strongly never to try and blag your way out of something. If you don't know, then basically own up, fess up. I've many a time said, I'm not going to charge you for today, or it doesn't count as one of your sessions because I don't know that I'm the right person for you. And that might be a personality thing. I've got a couple of times where I've come up against really kind of probably this conversation says it all. I jump from conversation to conversation. I've got a very excitable mind, and therefore I'm not always good at structure. And so sometimes I lack the structure that the person in front of me needs. But one of my colleagues is so awesome at it that I can move them over. And I'd rather move them to another clinician, or have the confidence to say, you know what, I'm not the best person for you, either from a personality point of view or from a clinical point of view. But actually, I've got somebody who'd really fit really well with you, and I'd really feel more confident if you would see them. So I think that was powerful message number one. And I guess My second one, if I'm allowed one. Can I
Oh,
keep
God, yeah.
talking? You know me.
Oh, God, yeah, brilliant.
Get me on a flow.
Right here. It's a great thought. Keep going. I'm going to shut up. Keep going.
The second one is a very dear friend of mine, is one of the lead nurses for Parkinson's. And quite early on in our career, she was doing some motivational interviewing. And it wasn't something that I'd heard of in physiotherapy terms at this point. And I didn't really know what it was, if I'm honest. And she said to me, she wasn't very good at presenting. I did lots of teaching. So she said, would I look at the PowerPoint and would I look at this presentation? So I'm reading through the slides, and the first slide said, ask, don't tell. And I thought, well, what's all that about? And so I carried on through this presentation. And I realized that looking back, I'd grown up in that world where the consultant told me what to do. I told my patients what to do. As a parent, I was seemingly quite good at telling my kids what to do too. And I took a big hard look at it, and I went back to her and I said, look, I need to talk to you. I don't have a clue what this talk's about. I can make the slides look really pretty and they can all fly in and they can do crazy things. But I said, I'm more intrigued by the content. Tell me the story. And maybe then I can add some pictures to it. And we got to talking, and I began to understand that basically I was too good at telling patients what I thought that they should do. And I didn't need to have all these answers, because quite often the patient had better answers than I did about what was right for them. And so I started to ask my patients, like, just small choices. And over time, that research has come to light. I'm not sure whether I've ever chatted to you about this. Optimal, it's an acronym, but it's basically stands for lots of posh words, but it's about motivation. How do we get people through intrinsic motivation? So what's the benefits to them? The stuff we've been talking about, not bribery and corruption. That I was very good at, getting my kids to be good all week so they'd go to the sweetie shop. Didn't seem to change their behavior, but cost me $5 at the sweetie shop every week. And I began to really change it. And then I've come across research more recently, which there was a fascinating one about taking a golf putting drill. These guys weren't particularly good at putting, but they were taught how to do some putting. And they had to hit targets. And then 2 weeks later, they looked at the retention of that skill acquisition and how well they'd learned it. And what was fascinating is the group who were allowed to choose the color of the golf ball wasn't weighted any differently. It wasn't that there was anything different about the skill other than they got to choose the color of the golf ball, retain the skill for longer, and had better outcomes. And I'm like looking at this thing going, don't be ridiculous. This can't be right. So I started to play with it. And the more research I look for about, we just decide that we're going to give somebody some feedback on their drop jump. But actually, do they want feedback on the good reps or the bad reps? So do we want to reinforce when we give them feedback? Do they even want feedback? Do they want time to create their own movement solutions and feel the movement? Or do they want to be told, you know, that's a really, really good one. That was awesome. That's the one we want to remember. But we've all been grown up on, oh, you know, your knee dropped in and your foot's a bit flat and you're a bit heavy. And so we come back to this language that makes or breaks skills. And it really came from my dear friend Patsy, who basically said, well, why not just decide that she's a prescribing clinician? She can't decide that the patient can decide, you know, whether they take 2 tablets or 4 tablets. That's her job. We decide what exercises are going in, but does it really matter to us if they squat first or lunge first? So what aspects of the prescription can we let them choose? Do you want a green bag or a blue bag? Do you want this? Do you want that? And so I now try and look, and we spend about an hour on every course making clinicians think about how they could change their therapeutic language to give the patient a choice that doesn't change the outcome. That's our job. But it actually changes the motivation. It changes the engagement. And what most of them have said is when they do it with their adult patients, their adults respond better too. It's not just kids.
Yeah, it's really interesting, and that's how I my course again, and what I teach about is like, how do we dose people? Why are we giving one exercise over a different exercise? And especially with people in pain. So after we do maybe a practical element, says, I'll give you an example. We would go through different variations of squats to see if one of those squats either A, modifies the pain, helps the pain, and makes the patient feel good or perform good. So we'll go through different variations and get them to do that. And then there might be 7 or 8 different variations you could try, and 2 of them came out on top where the person goes, oh yeah, that worked really well, or that really helped. And then I'll go to the group as well. So which one are we going to do? To see it, and it's like going, no, we ask the patient which one they want to do. So you say, like, which one would you prefer to do? And then they'll go, which one did you think it was the most? And then I go, you can have both, or you can have one, your favorite one, or we can choose something different. It's unbelievable how much even physios, without going through what you just said, just instantly go, yeah, I'm going to pick this one. And they have this kind of, all their body language goes with the fact that they've done that. And it's all associated with improvement in pain. And that's what I'm saying. If you just send somebody away with something like that, less is more, and they've control over it, they've modified symptoms, and they've chosen it. It's like it just matches with all the research we have around intrinsic control, and then that drives motivation, and then it just snowballs from there. See, it's the same thing that I think a lot of that stuff you talked about there it comes from Nick's book. Professor Wolf, she's out of Nevada University. Yep. I think she does a lot of that external control. Correct. And Paula Van Vliet as well, like not queuing every time. I think it was 1 in every 3. You mentioned there as well. I think I just wanted to highlight that for anyone listening is her research was really interesting around if you queued somebody 100% of the time versus 30% of the time. So one I really like this quote is those who were queued every 1 in every 3. They did much better than ones who were queued every single time. And it ties in with you again. Is people just want that space to just learn. And I often will teach this, like, you'll hear patients going, no, I haven't got that one right. Or they're talking to themselves because they've seen it. They've seen you demonstrate. They're just now trying to work it out. And the last thing you want to do is jump in there where they're just trying to process what you've told them. And also they need to make a mistake to then feel it and then go, no, that's not right or wrong. And it's so powerful that it makes such a difference.
I think that is, I think no question, that whole constraints-led learning that we see is massive in junior coaching these days is let the child have a set of parameters, let them make up the rules, let them have play, and through that they learn. And I think now that you'll see a lot less screaming from the sidelines from a coach and a lot more of them finding their own solutions to different concepts that we bring up. But the other thing that just sparked in my mind then was perfectionism. Now, quite a lot of these young kids that come and see me are pretty damn good at sport. And they very rarely, if you think about a tennis player, like I was that person. So which nutter is going to spend before school, during school, after school, and every weekend, one-on-one, basically drilling themselves to do the exact same thing. I just used to hit hundreds and hundreds and hundreds of forehands, and then hundreds and hundreds and hundreds of something else. Same in golf. Like that requires this ability to hyper focus and basically perfect something till it's good enough. And I'm not saying that we should do that rote repetition. I'm not a massive believer of it. But actually what's interesting is a lot of these kids who do those types of sports have real perfectionism traits. And I think language with those perfectionists, we have to be very, very careful. Because when we suddenly give a child, let's say, for example, the child's been really competent, they're really good at what they do, they've always found things come to them really easily, and we suddenly give them a skill set that's maybe just like I did to you at Therapy Expo. After, a few pints the night before, I then gave you a pile of words that was just too complicated. My bad, not yours. But I gave you a whole set of exercises and you kind of went,
oh yeah,
what? And then now I've lost that therapeutic relationship. And so I think what's so important is we recognize that kids sometimes particularly, but also adults are perfectionists too. They're not used to getting things wrong. They're not used to finding it difficult. And the analogy I use is, if you imagine when you learned to drive, effectively, what I say to the older ones is, if you were learning to drive, your clutch control was really jerky. You couldn't think of anything else. Basically, at that point, all you could try and do was one physical skill, and it wasn't smooth. And I use the handwriting for kids. You used to have to hold the pen and think about how to hold the pen, and then you had to form your letters. And now you don't even have to look up from the board. You just write, and it's become effortless and it's not conscious anymore. But I think there's a phase where we've got to remember, when we give people therapeutic interventions, it's a bit like learning to write again, specifically if they've gone through a big growth spurt, specifically if they have an ACL injury or they're out for 8 months, one side and the other side of puberty. This kid's gone into the injury pint-sized and in control. They've come out of it looking like Bambi on ice. And with that, they've now got to learn all these complex movements that this crazy physiotherapist has dreamt up. And now they look stupid. And they don't like looking stupid. And our job is to set achievable tasks so that they feel that they can get a measure of success. And it's a real fine line between not patronizing and making it so easy they don't feel proud of themselves, but setting a suitable level of challenge that actually makes them feel like, yeah, I could do this. We call it enhanced expectancies in that Wolf paper. And it's very much about trying to find a medium to create success and boost confidence, but not break it. And I think it's good to take kids back to, when you used to learn to ride your bike, it was really hard, it was really awkward, but now you don't think about it and you can use your mobile phone at the same time. We've got to go through that process in the clinical room. So don't fret about it. Kids your age shouldn't be able to do this. This is normal. And trying to create that environment where those kids who are used to success suddenly find this journey really hard.
It's interesting. I put questions I wanted to ask you. Just as
I haven't let you get a word in, have I?
I've written down what are the... No, it's great. No, that's. I'm glad. This is good. This is why I did this. People who speak more than me, it's amazing. What are the key factors, in your opinion, that support a good environment? It was actually my second question I was supposed to ask you, but this the way things. This is the beauty about communication. It goes and goes and goes. I've written so many words down, but that exactly what you were saying is like, how do you provide that environment for them to feel challenged? But as you say, not quite knock them off. But at the same time, do you set that up? I suppose I'm asking a question at the same time, just making a statement, I guess, at the same time. It's that kind of like, what are the things, I suppose anyone listening is like, how do you create environments for different people, for them to feel safe and not feel shame, especially when they come off a background of perfectionism is what you're kind of, hopefully I've interpreted it right. And those things is you probably, and I would like your opinion on this, is sometimes you're going to get that wrong. And I think that's the key thing maybe to get across. And I make communication errors all the time. And I think like with anything that you're trying to get good at, you should be making errors in it in some ways, not drastic errors like, something daft, but, just where you push somebody. And there is a fine line between challenging someone's beliefs and attitudes, which is difficult, especially in that age group as well, I'm sure, is that, but sometimes you need to do it. And sometimes you then need to be like what you said, was transparent and going, look, maybe I've been a bit too harsh there, or maybe I've said that in the wrong, let's talk about that. So using the mistake in your language as a way of even getting that back and getting them back on board. What do you think about that kind of thing? Or,
I think
making errors and mistakes in communication?
Is that if I know things haven't gone so well, or the child's got that perfectionism trait, then I'll very much explore with them that if they're perfect, it's very hard to improve. And basically I don't want, so when I'm, say, for example, let's say I'm doing a series of tests, I'll always say to them before we start, we're going to find lots of things here. The worst thing that can happen is that you sail through each of these without me finding anything, because how can I make you better if we don't have anything to work with? So I'll set them up with the knowledge base so that they're not worried every time they have a tight hamstring and then they have a sore back when they do this. Is the more I find, the more fun we're going to have, because the more things that we can work on during your rehab while your injury's getting better, then basically the better you're going to be when we go back to this. And if there's something that you don't understand and you want to ask the question, it's really important that you ask that and you feel you can. And if I'm not explaining it well, then I want you to tell me. But I think the one thing that I would say I do is I believe it's a part of that motivational interviewing, that not all of it was right and it was set up for alcoholism and drug abuse, but there's so many concepts that we can take from it within physiotherapy environments. And one of them was reflecting it back. So when I'm in the subjective, I'll often say to the kid, as I understand it, when this started, you were playing sport and you fell over and this is what happened. Have I got that right? And if they look a bit glazed, then we all know from our kids that maybe you haven't. Okay, can you explain that to me again? And how, what bit of it have I not understood? And then after we've got their exercise prescription right, then we'll sort of say, right, or I'll tell you another really good thing that may work is that children need to have their diagnosis explained to them in a very simple way. And the wording that I use is in a way that they can use in the playground to explain to their friends what's wrong with them and why they can't play in the team on Saturday. So in words that they can use and repeat. So once we've got through that, this is what a lumbar stress fracture is, this is what a Osgood's is. Right. Do you want to have a practice now? Because it's going to be quite tricky for you because some of these words aren't that familiar to you. So why not have a go with me now of seeing whether you could repeat it back before you have to do it with your mates or your coach? Do you want to have a go at it? And some say, no, I'm cool with it, I've got it. And others go, yeah, okay, let's try it. So we use that time to maybe reflect. And all it does is tells me whether they still have any fears or like doubts about what's wrong with them. And then we do it at the same. And then when they're leaving, I'll say, if we're going to get you back on that footy pitch in 12 weeks' time, that's the best case scenario. If you can't find the time to do your exercises, don't not come back. Like basically, if you've not been able to do them for whatever reason, it's probably that I've set you too many or you've not understood them. But the important part is you come back and see me and we work through that, or you can message me in between. But importantly, you've got to understand is if you don't do those exercises and you don't get back to me and tell me, that there's a problem, it could add more weeks onto your treatment program. So instead of 12 weeks, we have to understand the implication that if I've not explained it to you and you've not understood the reasons why you need to do this, don't come running to me in 12 weeks' time saying you said 12 weeks. And so I also shift those expectations at the same time as reflecting back what our contract is that we've agreed to. And that really helps with parents. But you said.
Yeah, brilliant. You just said it, it's great. It's the same with adults. It's really interesting. Because of what you're saying about all that, that's, as you said, contracting, locus of control, trust that it's okay if it doesn't go well, we'll adjust it. So, it's a relationship, it's a collaborative approach. You're saying all those things, which is no different than whether you're treating an adult or a child. What's really interesting, I don't know if you ever noticed this, because I see a fair few amount of young adults and kids. And what's interesting is the parent will always kind of go, you can see them, because how I maybe use the communication with the kid, the parent is going, and they've got an injury. And they're like, they've obviously had heard things before, and they can see the approach of that collaborative and that commitment and the idea of how you're going, look, if you do a really good job here, we can push you on. We can probably tie into that, like this is an opportunity even. This injury, we could even work on things that you haven't even worked on before. I meant to say that to you earlier as well, that idea of, those perfectionisms. It's like going, well, we could actually teach you stuff here that your performance might improve when we get back. There's a good chance of that happening. But often the parents will book in for an appointment afterwards. they'll often, because, and it's not, and whatever about it, but it's exactly what you just said. It's in that language that you obviously sometimes when you're talking to kids, you're very clear what it may be, but actually that's kind of what you need to do with adults as well. And when adults hear it, they'll go, Jesus, I've not had that before. And maybe anyone listening to this who deals with adults, it's crossover is huge. You know what I mean? It's all the same principles, and all the research there with regards to motivation and feedback is all the same, because I research all that stuff for adults on my course. So it's exactly the same. It's interesting.
Maybe we could just sub in for each other periodically. I bet you and I could just basically rock up and teach the course.
but again, like everybody else who's been on so far is saying the same things as well. And again,
that's good.
But what I want to do is just bring an awareness to that. But it's the skill, isn't it, Angela? You've thrown out absolutely. I'll be clipping you up like no tomorrow on this, because there's so many really, and I was really hoping for that over this chat. There's definitely practical things. I've got notes everywhere, and I can't wait to listen back, because there was so many little things of I can apply that tomorrow in the language. You know what I mean? That's not complicated things you're saying, but they're really, I don't think they're done well enough. And I think what's really interesting coming back on you is you've got a real deep, and I'm really interested in empathy and where we get it from and why we get it. And you've got a real proper deep empathy because you went through it as an adult, as a tennis player, a high-level tennis player, and then that idea of knowing what that feels like, and then creating an environment for that kid to survive. You know what I mean? To where do we get our empathy from? And you can clearly see that it's gone from there into what you do now in your profession. And I think I'd like anyone listening is that you can always improve your communication just by reflecting on some of the things that that were hard in your life, and then help to kind of help those people in your treatment or your rehabilitation by using that kind of drive, because it came straight out of you in that. And that comes across in your genuine, when you talk about talking to kids, you're talking genuinely about it. It's like you're talking from your 15-year-old Angela to the 15-year-old who's in the room. There's no kind of like patronizing, because you can't be patronizing if you're authentic with it. So
I think also
what you know what I mean?
Both my children have had some real big setbacks. And I think they would both acknowledge that maybe some of those setbacks were necessary for making them better athletes and better people. And I think, a lot of kids just fly through schooling, exams, and at some point they're going to come a cropper. And so sometimes kids and adults need to have a few setbacks in order to maybe build that empathy. And certainly watching Andy and Sarah grow up and some of their setbacks, they've both got learning difficulties, both had things that they didn't get picked for in sport. And I actually think it's really, really helped them become better in their current roles. And just watching them, I learned so much from them, what worked, what didn't work, trying to reflect on how I was parenting, but also observing how they related to coaches. And they're wiser than I am now. I find it absolutely awe-inspiring how young people can basically teach us so much. And I think that's the power of communication is understanding that if we just sit back and listen and watch sometimes, we can learn how it goes better.
Yeah, that's brilliant. That's a perfect way to really wrap up this, because you've just got that self-awareness, self-reflection, and that communication is everywhere, and that you can always fine tune. You can walk out the door. Ben Cormack said the same thing. Walk out the door and start to change it. You can look at my, interaction with your kids. You can change it straight away. Like it's the most skill. You can continuously kind of go, wow, that's amazing. Imagine if I just implored that in, not implore, but use that just tonight with kids, and it just changes straight away, and it's a skill that you kind of keep happening, and suddenly you're in with, I don't know if you find this, you're in with a patient, and then what comes out of you, or you just wait that time, or you just ask that question, and you just have that reflection on how it went the last time, and next thing that patient says something, you're like, oh wow, where did that come from? And I think that's why communication can be quite difficult, because sometimes it just happens, but it doesn't just happen. It's like every other skill. It's happened because you probably challenged yourself. You've been reflecting on this over time. You've been reading around it. And I think that's what I'm trying to get from this podcast and the likes of yourselves, to implore physios or therapists to really like work at this and to kind of go away and look. You were looking at a presentation about motivational interview, and the next thing you know, it's gone. What is this to now? You're using that every day. It's great. Like some of the things that I even reflect on, like you've used give your person or your patient, a voice, that honesty and transparency around things. I think were some of the big factors I've taken away from what you've said, and I think you can use that with any person. But I think really, really useful, Angela. Is there anything else you'd like to finish on that you didn't think you got to say, or that you would like to leave, or anything like that, or recommendations about something like you want to improve as a therapist working with kids or adults?
I guess the main thing is that we know that kids are quite scary to work with. We don't do them at undergraduate level, and people fear that, and they forget. Like, one of the things that I would say consistently is I get feedback saying from the courses that I give is how much fun they have when they are working with kids, and how there are so many similarities that you've pointed out today. And kids aren't really that scary once you've got a few basics, but they're so much fun to work with, and they are so, I guess, open and honest, and they carry a lot less of the baggage that the maybe adult who's had multiple pains have. So they're just so refreshing to work with, and I'd love to get more people getting that passion to work with children, not fear them, and get that confidence to go and have fun with them.
Oh, brilliant. And like anyone who's obviously wanting to get into this field, as you know, your education, I've been loving it. Like I've actually got a little Angela folder on my phone, actually, slides. Remember I told you this, I couldn't find it because I was too pissed. But I found it. You weren't under where I'd expect it to be. So I've got my little, it's just a little, there's you at the bottom. We were on the same conference, I think. It was the Therapy Live or something like that. So yeah, I have my little picture. So you are absolutely brilliant what you do, and I think I would encourage anyone to go and to learn from you and get wherever they can get anything from your information. I'll put any connections to you in notes and stuff like that. And I know you've got some online stuff, which is brilliant. So
yeah, I mean, aside
from the
teaching, aside from the teaching, the kidsbacktosport.com website's just got tons of free resources. So people are welcome to go and download those for patients, send them links. My main objective is to share educational content so that parents have got somewhere to go. So in addition to the work we can do with clinicians is also helping clinicians to provide non-fearful educational material for patients and parents. So that's one of the big drivers for me, getting that library up there.
Yeah, that's great. No, yeah, brilliant. Thanks a million, Angela. It was a great talk.
My absolute pleasure. Thank you.
Thanks for listening to Teacup. If you liked it, tell all your friends. If you didn't, well, maybe you'll like the next one. Go to procareeducation.com or Procare Education on Instagram for more information on courses and the Bamboo Project. And remember, always be sound and not a dickhead.